Today I will discuss the implementation of laboratory quality management systems in resource-limited settings. My name is Alex Costa, and this lecture was presented at the 7th Advanced Course on Diagnostics in France in September 2016. The presentation will be divided in three parts. First, I will provide a brief introduction to laboratory quality management systems. Second, I will discuss available laboratory quality management system resources, and I will focus on two of them, SLMTA and LQSI. And finally, I will finish the presentation with a tutorial to assist you on implementing a quality management system in your laboratory, and we'll discuss some of the challenges and lessons learned. I would like to start by emphasizing the importance of quality management. And I'm going to use the global airline industry as an example to explain how quality management is essential. There are 100,000 flights every day, globally, shown here as green lines on this map. About 3 billion people, almost half the global population, fly every year. Yet, in 2012, there were only 6 crashes. That's actually very impressive. The failure rate was only 0.006%. Now, would you accept a system that is 99% efficient and has only a 1% failure rate? Would you accept it? Think about it for a moment. Most people would say yes, because 99% sounds really good, but they're not really thinking about the consequences. If you accept 99% efficiency in the airline industry, you will have to deal with 1,000 crashes every day and 30 million dead people every year. Quality management in the laboratory is not that much different. If you accept anything less than 100% diagnostic efficiency, you are also accepting that part of the results issued by your laboratory will be wrong. And this could be the difference between life and death for the patient or whether a disease outbreak will be contained. So back to the laboratory. How would implementation of a quality management system benefit the laboratory? Think about it for a moment. First and foremost, it would increase the number of laboratory results which are reliable, accurate, and timely. Second, it would improve the use of available resources, which is particularly important in resource-limited settings. A more efficient use of resources would also reduce the costs of laboratory diagnostics, which could in turn increase access to laboratory diagnostics for patients in resource-limited settings. Laboratories implementing a quality management system also inspire more credibility among patients, physicians, government agencies, partner organizations, and donors. More credibility also translates into more money. And finally, these laboratories are better equipped to respond to public health events, such as disease outbreaks. So before we continue, I think it's important to define what laboratory quality management systems are. A quality management system affects every single process in the laboratory and consists of several layers that can be described using the pyramid structure shown here. At the base of the pyramid, you will find inspection, which is nothing more than the subconscious inspection of laboratory activities by the laboratory technologist. Because inspection is a subconscious process, detection of mistakes depends on the level of alertness of the technologist. The second layer of the pyramid is quality control, which functions to detect and correct problems when they happen. One example is the use of internal quality controls, or IQC, which allows the laboratory technologist to monitor performance of the test and ensure that the results are accurate. The third layer of the pyramid is quality assurance, which is designed to prevent problems from happening. For example, problems can be prevented through standardization of laboratory procedures following standard operating procedures or SOPs. Another example is the laboratory's participation in external quality assurance programs or EQA, which are used to regularly monitor the laboratory performance and therefore prevent problems from happening. To control and assure the quality of laboratory tests, many activities need to be executed. This is the role of the quality system, which is the next layer of the pyramid. Quality systems refer to the organizational structure necessary to ensure that all staff, materials, and resources are present at the right place, at the right time, and in sufficient amounts. For example, an efficient quality system will ensure that an appropriate number of trained staff are in place, that equipment, reagents, and supplies are always in place, and that manuals, guidelines, forms, and SOPs are also in place. And finally, no quality management system can function correctly and sustainably without proper planning, leadership and management, and monitoring and evaluation. All these activities are covered by quality management, which is at the top level of the quality management system pyramid. So as you can see, laboratory quality management systems are very complex. In order to organize these different elements in a more rational and practical framework, the Clinical Laboratory Standards Institute, or CLSI, created a framework composed of 12 building blocks called Quality System Essentials, which are shown here. The Quality System Essentials are based on the ISO 15189 standards, which specify the requirements for quality and competence in medical laboratories. These include organization, personal equipment, purchasing and inventory, process control, information management, documents and records, occurrence management, assessment, process improvement, customer service, and facilities and safety. Although this framework organizes ISO 15189 requirements into thematic quality systems essentials, it does not translate the ISO 15189 requirements into activities that can be easily implemented by laboratories. This slide provides an overview of resources that can assist laboratories in the implementation of a quality management system. The tools described here have translated the ISO 15189 requirements and CLSI Quality System Essentials into discrete activities that can be implemented by the laboratory. It's a bit hard to see because the font size is small, but I wanted to show you this slide because the right column lists the websites where more information can be found about each of these tools. I will now zoom into the red area and to review details about 4 laboratory quality management systems. The first column shows that all tools described here can be used in all types of medical laboratories. The second column shows the titles of these tools. The first one is the WHO Laboratory Quality Management System Training Toolkit, which is used mostly for education, training, and awareness. The next 2 tools, SLMTA and LQSI, are used to provide direct support for quality management system implementation at the facility level. Both of these tools use a stepwise approach to support implementation of a laboratory quality management system based on ISO 15189 requirements. I will talk more about these tools in a moment. The last tool is SLPTA, which stands for Stepwise Laboratory Improvement Process Towards Accreditation. SLPTA is often used for external assessments and internal audits of labs implementing a quality management system. There are also specific tools to support implementation of laboratory quality management systems in TB laboratories, but I'm not going to describe them here. I would like to go back now and give you more information about implementation of two laboratory quality management system tools with which I have more experience. These are SLPTA and the LQSI. SLPTA stands for Strengthening Laboratory Management Towards Accreditation. It was developed by the Centers for Disease Control and Prevention, the US CDC, and the WHO Regional Office for Africa, in partnership with the American Society for Clinical Pathology and the Clinton Foundation. SLPTA is a hands-on, activity-based tool that prescribes specific tasks to improve laboratory management. It consists in a series of short courses followed by laboratory-based improvement projects implemented in the laboratories where the participants come from, and supported by on-site visits and mentoring. It teaches laboratory staff how to implement practical quality management activities using the available resources. The diagram at the bottom shows the key activities in this program. The first step is to perform a baseline assessment of the laboratory. This is followed by a workshop where both theory and practice are taught to the participants. The participants leave the workshop with homework, which consists in implementing over the next 3 months what was learned during the workshop in their respective laboratories. During this period, the mentors will visit the laboratory to support implementation of these activities. This cycle is repeated 3 times before an exit assessment is done to measure improvements in the laboratory. This radar or spider graph shows the baseline assessment in blue and the exit assessment in red. This assessment is done by trained assessors using a checklist as an external auditing system to measure the performance of laboratories according to a 5-star system. After the assessment, the laboratory is awarded between 1 and 5 stars depending on the score achieved in the checklist, using the checklist. Laboratories that progress through the Stepwise system and achieve 5 stars can start preparations for ISO 15189 accreditation. So now I want to switch back to the WHO LQSI tool. LQSI stands for Laboratory Quality Stepwise Implementation Tool. It is a web-based tool developed by the Royal Tropical Institute on behalf of the World Health Organization. It translates ISO 15189 requirements into step-by-step activities, which are organized as a roadmap divided in 4 phases. The roadmap provides the recommended order of activities for day-to-day implementation. Clicking on any of these activities will show what must be done in 1 sentence. And if you click on each one of these sentences, you will obtain an explanation on why the activity must be done, what must be done, how the activity can be completed, and who should be responsible for it. Whenever possible, the tool also provides links to templates and training materials so you don't have to reinvent the wheel. The LQSI tool also provides an interactive checklist that can be customized by assessors to monitor implementation of the quality management system in the laboratory. Cambodia was one of the first countries to pilot the LQSI tool. Without any prior experience, we relied on the experience of SLMTA implementation in other countries and developed the implementation system that is shown on this slide. Implementation begins with a one-week training in the LQMS principles given to laboratory managers, quality officers, biosafety officers, and equipment officers from each participating laboratory. The idea here is to sensitize everyone who's going to be involved in implementation. Hospital and provincial directors also attended the opening session of the training to ensure leadership involvement and support. Training materials were adapted to make it more relevant and culturally sensitive, and the training was conducted both in local language and English. The experience of SLMTA implementation in Africa shows that the highest rate of success is achieved by combining implementation of a quality management system with continuous in-service mentorship, whereby external mentors rotate between laboratories every few weeks. So although the LQSI is a tool that can be implemented independently by the laboratory and without any external assistance, we used the lessons learned from SLMTA implementation in Africa and recruited external mentors to support implementation in the laboratories. Each quality mentor was assigned to 3 laboratories where they spent 1 week at a time. So each full rotation takes 3 weeks. Each week starts with a brief assessment using a checklist adapted from the LQSI tool. During each week, the quality mentor assists the laboratory staff in the implementation of activities listed in each phase of the LQSI tool, starting with phase 1 and progressing towards phase 2, 3, and 4. Laboratories will be ready to seek accreditation as they complete all activities listed in the LQSI tool. LQSI implementation in Cambodia started with a baseline assessment of the laboratories using the WHO Laboratory Assessment Tool available for free download on the WHO website. The WHO Laboratory Assessment Tool generates quantitative information about the laboratory performance according to quality system essentials. The table shown here summarizes the results of the baseline assessment of 22 laboratories, in which the scores have been color-coded to facilitate visualization. Shown in red are the areas with low scores, in yellow the ones with intermediate scores, and in green are the areas with high scores. It's very easy to visualize that some areas are performing very badly. For example, public health functions are performing at a low level in most of these laboratories. So LQSI implementation began in August 2014 with a cohort of 6 laboratories, which are shown in red. Within 4 months, all laboratories had completed 80% of the activities in phase 1. A second cohort of 4 laboratories started implementation in March 2015, shown in blue. Because of the accumulated experience of the mentors, it took only 3 months for the second cohort to catch up with the first cohort. The laboratories started implementing phase 2 activities once they plateaued around 80%. This is because some activities in each phase are more difficult to implement, or the implementation depends on external factors that are not under the control of laboratory staff. This means that at any given time, laboratories may be simultaneously implementing activities that are listed under different phases of the LQSI tool. So now I would like to finish the presentation with a brief tutorial. This tutorial is based on breakout sessions that were organized in the last 2 years of the advanced course on diagnostics, where this lecture was presented in 2016. So please note that I'm not prescribing the following sequence of steps, but offering them as a suggestion to support implementation in your laboratory. So number 1, is there a regulatory framework, such as a national or institutional policy or plan? This is very critical. It's very difficult to move forward if you don't have a regulatory framework to support implementation of a laboratory quality management system. If your institution or country does not have a policy or plan, my recommendation is that you start by working with the leadership in order to establish the regulatory framework. Number 2, perform a needs assessment. You need data, you need evidence to decide, for example, which LQMS tool would be more appropriate for your laboratory. For example, laboratories with very limited resources at the periphery would probably be better off implementing SLMTA, which is more of a hands-on approach to LQMS implementation. On the other hand, laboratories at a central level with access to internet would probably benefit more with LQSI implementation, especially if they already have some experience implementing a quality management system. Number 4, estimate the initial cost of implementation. This is just the initial cost. And this varies from country to country and also varies depending on the tool used. LQSI is very cheap to implement because it's a web-based tool that the laboratory can download and run on the computer and implement at their own pace. SLMTA usually requires support from a partner organization because it involves workshops and on-site visits that cost much more money. Number 5, develop a plan. But the plan must be developed together with all laboratory staff. This will ensure ownership and support from everyone. Number 6, ensure management support. For example, use the evidence of LQMS benefits to secure support from your management. It's very difficult to proceed if your management does not support implementation of an LQMS. Number 7, train all laboratory staff on LQMS principles to support implementation. This is usually very simple. It's a half-day training or a one-day training, but it will ensure that everyone involved understands what is about to happen in the laboratory. Number 8, prioritize activities based on assessment results, the LQMS framework that has been selected, and budget availability. Number 9, establish partnerships to support implementation. Partners can assist both on a technical level and financial level, but very often they will be able to facilitate implementation of quality management systems in your laboratory. Number 10, start small and build momentum. Improve understanding and trust of those involved in implementation, and build evidence to secure additional support. 11, communicate regularly. For example, communicate the results, the challenges, the success stories to all relevant stakeholders. 12, monitor implementation with checklists and internal audits. That would allow you to monitor how fast or slow you're progressing and detect problems before they block implementation of the quality management system. Number 13, keep upper management involved. Without their support, you will not be able to move forward. So, what are the common challenges and what have we learned from them? and implementation in Cambodia and other countries as well. A very common challenge is limited resources. After all, we're talking about implementation of quality management systems in resource-limited settings. So the recommendation here is to map the resources before implementation. What are the technical and financial resources available for implementation? Second, prioritize activities and be creative. There are many activities, especially in the initial stages of implementation, that are low-hanging fruits. They're very easy to implement. So if you prioritize those activities and you're creative to implement others, you'll be able to move forward relatively fast, and that's going to be very encouraging for all involved. And then use this initial success to mobilize more resources. Another common challenge is the limited commitment by laboratory staff, because implementation of a quality management system requires additional work from all involved. The recommendations here include to provide basic LQMS training to all involved, as was mentioned earlier. If possible and resources are available, to provide in-service support by laboratory mentors. In addition, focus on the positives and document the benefits that would allow you to build more commitment from those involved or by those involved. And finally, monitor progress regularly using checklists. I think it's very important, and I would like to emphasize that building a body of evidence of how you're progressing towards implementation of the LQMS and therefore ISO accreditation is something that will build commitment, especially by the leadership. There are many issues beyond the laboratory, for example, political issues or procurement problems. These are very difficult to resolve because it's not under the control of the laboratory. The recommendation here is to keep the leadership informed and involved because it's going to be up to them to advocate on your behalf. Limited laboratory capacity. This is very common as well. Many laboratories are daunted by the challenge and the complexity of implementing a quality management system. The reality is that all laboratories should have a laboratory quality management system. It's a matter of time until your laboratory has one too. So it's better to start now and start small, within your constraints and given your capacity, and follow the laboratory quality management system framework that you have selected at your own pace, and you will get there. And finally, the language barrier. The recommendation here is that all laboratory quality management system materials should be translated into the local language, and training should be provided at least in the local language, but ideally in the local language and English when relevant. And this is the end of the presentation, and thank you very much.